Are you struggling to master the concept associated with the fundamentals of nursing? You are not alone. In this video, I'm going to show you how to study fundamentals. 3 simple steps. It's called what, why, and how to link it to whatever you're talking about. This will help you master fundamentals for nursing school and for the NCLEX. Let's get to it. 3 simple strategies to master fundamentals of nursing. The first thing is what? What are we talking about? Every concept, there is a what. There is something associated with it. And what is that? The what is what? The concept, the definition, the basic fact you're talking about. Straightforward, right? Every topic the teacher is going to talk about is going to have basic fact. And you have to write it down. Example, standard precaution. If you're talking about safety, that is the what. If you're talking about what? Restraint, that is the what. If you're talking about medication administration, that is the what. If you're talking about delegation, that is the what. So example I'm using is standard precaution. Define it on your own. What does standard precaution means? If you are able to define it, then the what has been conquered. And what does that mean? It's an infectious control measures used for all patients. It doesn't matter. Everybody gets standard precaution. And therefore, write it in a simple, clear language and describe it. This is the descriptive aspect of it. The what is standard precaution. I don't know what standard precaution is, but if you can write it and describe it to a young child that what standard precaution means, you have internalized that information and it will make the concept easy. That is what we mean by concept. The what, and then after that, why? Why do I have to know standard precaution? Who cares about standard precaution? And that is the why. What does it mean? It's the reasoning behind the rule. There is a rule for standard precaution. The NCLEX wants you to know the rule for contact, the rule for airborne, the rule for the droplet, and the rule for standard. If you know it, if you master the what, which is standard precaution, and then the why, there is a what? Rules for each of these organisms involved, and your action, what you're supposed to do, that's all. Example, in the standard precaution, the reason why we're ensuring standard precaution is to reduce the risk of what? Pathogen spreading. You don't want to touch the blood, the body fluid, the secretion, whatever, and you don't want to carry it to another patient. So you ensure a standard precaution based on what you're doing. There is a rule, and that is the why, reasoning behind what you're doing. Connect it to what? The pathophysiology or the patient safety issue you're talking about. You have to do the connection. The what and then why I have to do is there's a reason why you're doing. That's the rationale. So when you look at questions, you're doing your Q bank, you say, what is the rationale? They select this question. There's the why. And then finally, link it. You got to link it to system. You got to link it to what somebody will ask you. You know what is the problem, standard precaution. You know the why you're doing it. If something happened, you got to link it to. If you see a question, you got to link it. If patient do something, you got to link it to. If you see a situation, you have to link it to. And that is the how. How do you link it? Link it to other nursing concepts like prioritization. Which of these patients I should provide safety first, right? Which of these patients I should give them the medication based on what? The what and the why of their condition. The what and the why, I have to link it. And that is the how to link it. Link it to other nursing concepts. Link it to clinical scenarios. NCLEX question. When you see it, why am I asking you about COPD patient and oxygen? You are linking, you are connecting the dots. I call them buzzwords sometimes. I'm connecting A, B, C. I said, these come together. There is a what of something, and there is a why of something. And now, what is the link? Why the NCLEX is asking me about COPD patient? I'm talking about oxygen. Example is this. If a nurse is drawing blood from a patient with HIV, you need the gloves, right? You link in it that you have to ensure a standard precaution. And now they give you a patient about HIV. They want you to think that now link your what and why to what? how to link it. And that is what? HIV patient. What do I need to do? Standard precaution. I need to wear gloves. If there's a splash going to happen, hey, I need to wear goggles and a gown. So when you see a question, keep on asking yourself, I have a patient in airborne precaution, and I'm going to change a wound. I know I need to institute what? Airborne precaution. I have to wear my N95. That's what I need for that condition. But now I'm linking it. I'm going to change the wound. There is a risk of a splash. I got to wear what? Gown. I got to wear goggles, face masks. I got to wear gloves because I'm changing the wound. You see, linking it, and that will make fundamentals easy. The what, the why, and how to link it. So I'm going to give you an example. This is what I mean. Connection, make knowledge stick together because you are now applying to situation. This is what they call clinical situation. And when you use this, you can use this even for case study, and it will become easy. Now, let's apply it. I'm going to give you 3 scenarios. Oxygen therapy. What is oxygen? Well, oxygen is administration of oxygen to improve what? Oxygenation. That is why I'm going to be giving it to you. You need oxygen. I need to improve your oxygenation, so I'm giving it to you. But what is the problem? I increases oxygen supply too much, it becomes a problem. You see, I'm linking the information. Example is this, COPD. If your COPD client become drowsy on 4 liters, reduce the flow, because if I increase it too much, it's going to take away their drive. So I know the therapy, the what, the why. I need to improve your oxygenation and how to link it. Increased oxygen supply too much can cause problem, and therefore you critically thinking. This is the critical thinking aspect of it, how to link it. Another example is vital sign, right? Well, it's vital sign. That is what it is. And what it is, I'm checking your temperature, okay? Pulse, respiration, blood pressure, and that to know what is going on with you. And I'm getting a baseline for detecting changes in your condition. If I see a small change in you, hey, I will figure it out. I will figure it out. So vital sign, what is vital sign? Your temperature, your pulse, your respiration, your blood pressure, and your pain. Why am I checking it? Because I got to know your baseline for detecting changes, so that when I see a new changes, I can link it. And the NCLEX will link it to you. Post-op patient, blood pressure is 88/50. That is abnormal vitals. How do I link it? I think this patient is unstable. Therefore, I apply it to prioritization, and I see this patient. Fundamental strategy, how to learn it for the NCLEX in nursing school. The next one is patient positioning. What is it? I don't know. Explain it to a kid and tell them what is patient positioning. It can be supine, it can be Fowler, it can be in a tundillable position, sim position, etc. But why? Why do I have to put you in supine position? Always ask yourself, what is the problem? Why? Why do I need to put you in a Fowler position? Well, it promotes comfort depending on whether you're having pain on your back. You can have ulceration, because I don't want you to have pressure ulcer. There's so many things. If you have like death spell, right? Why do the kid have to be in near to chest position? If you have what? Cord prolapse, why do I have to put it knee to chest position, right? Those are the things you've been thinking about, and you got to apply. You see how you can apply it to all situations, no matter the conditions, no matter the topic. Even maternity, you can use it. Any topic at all, you ask yourself, what is the problem and why? So why do I have to put you in supine Fowler position? I want to promote comfort. I want to prevent complication, like aspiration. Somebody getting bolus feet, why they have to be upright, right? These are the little things. And how do you connect it? Post-op thyroidectomy. They need to be in semi-Fowler position with the head support to prevent strain, right? Patient have pancreatitis. You got to place them in the fetal position to help prevent pain. All these things is very, very important. Pregnant lady patient, you don't want to put them in the supine position. Why? Because of hypotension, and you're linking it together. This is how you study fundamentals. So know the what of the situation, the why of that situation, and then how to link it. Like I said, the first one, oxygen therapy. What is the problem? I'm giving you oxygen. That's what it means. Why am I giving you oxygen? To improve your oxygen supply. But then if I link it, if I give you too much for COPD patient, it's a problem. Let's try a question. This is a safety question. A nurse is assigning rooms on the medical surgical unit, right? Assigning rooms, right? Which client is most appropriate to place in the closer to the nursing station? You talk about safety, right? Safety, safety, safety. That means safety is about prevention. You're preventing something from happening. What are we preventing? Either fall, complication, or any other thing. This question is talking about closest to the nursing station. Most of the time is fall. You have this patient, 42-year-old post-op appendectomy client who is stable. You have 80-year-old client who is confused, frequently attempt to get out of bed, warning sign. You have a 60-year-old client with controlled hypertension. This is how you apply your prioritization. You have a 25-year-old client receiving IV antibiotic for pneumonia. What do you think? I know you know the answer, but that is the point of this video. No, I don't want you to pick the answer. I want you to break it down and say, okay, what is the problem? We have a situation about safety because they told me I need to place somebody to the closest to the nursing station. You have to break the question down in your head. They say, why do I have to place this patient near the nursing station to prevent what? Fall. Then you connect the dot. If somebody fall, they get into trouble. Who is more likely to fall down? Prioritization. Connect the dot to the NCLEX. And you can see that intervention is going to prevent the patient from falling. And who's going to do that? Number two is supposed to be near the nursing station because he's confused. He frequently attempts to get out of bed. He has all the risk factors to fall. Next question, pain management, applying to pain. A nurse is caring for a post-operative client who reports with a pain level of 8 out of 10, 1 hour after giving them their prescribed medication. The pain is not responding. So what is the problem? Pain issue. Why do you have to manage the patient pain? That is the key concept of the question, right? Which action should the nurse take first? You see, you have to know why you have to manage this patient. And because you know why, you're going to use to prioritize to link it to the prioritization question. Document the client pain level and continue to monitor. The pain did not improve, even you're giving the medication. Why do you want to just document? You think, you know that there's something wrong. You got to do something. Reassess the client pain and effectiveness of the medication. That's the linking connection together because you know if you don't manage the patient pain, it's not going to improve. Call the provider to request a stronger pain medication, but there is prioritization first. It's a prioritization, something you can do first. Encourage the client to use distractive methods. No, the pain did not improve. Non-distractive methods are not going to work. Therefore, the concept here is like vital sign. The fifth pain is the fifth vital sign. We need to treat it. If you don't treat it, why? If you don't treat it, it will affect the individual healing process. And this is how you connect it. Fundamentals of nursing. This is how you study the what of the situation. Why do you need to know it? And how do you connect the dot? Thank you. Use this for your NCLEX. Use it for nursing school and master your fundamentals of nursing. Thank you for watching. If you like this video, put a comment down, click the like button so that we can support this channel. Take care of yourself and good luck.